Hi, everyone. My name is Teresa, and I'm starting this podcast in hopes to help people find more tools and education on all sorts of body work practices and holistic types of methods. And I actually own a business called Holistic Healing, and I named it that. It's not spelled with an H, it's actually spelled WHOLISTIC for holistic. And the W makes a really big difference because the W makes the meaning of it saying that I'm actually addressing body, soul, mind, spirit, like the entire totality of what it means to be a human being. And we are these amazing creations of God, but we are also very complex. So hopefully this podcast, as you listen to them or over the series of all the different subjects that I'm going to record on, you find tools and also ways to find the body work that you need, the body work that maybe you had no clue was impactful, that you had no idea of really the definition of it. And hopefully this expands that for you. So let me go over some of the things that I do. So I'm a licensed massage therapist, and that's one of the things I do. And in the umbrella of that, the modalities that I specialize in are medical massage. I went to a medical massage school, and I also do myofascial release, cranial sacral therapy. I do Reiki. I teach and certify people in Reiki, and also to the point of them being able to teach and certify. I teach all sorts of workshops on like PTSD and then health and A&P, which is anatomy and physiology. I teach yoga. I have taught yoga for a really long time and been practicing. It will soon be 20 years that I will be practicing yoga. And I also teach and administer like healing meditation, advanced forms of meditation, like a lot of different levels of meditation. And also I will sometimes during treatment or body work bring types of meditation into the practice so that the client is co-laboring with me while I'm actually doing the healing work. So I love what I do, and it's quite a dynamic of many subjects. But this podcast, I'm going to name it Pivotal Practices. So that's going to be really the focus of it. I'm going to sometimes teach a yoga practice. Sometimes I'll administer meditation. Other times it'll be really in-depth in education, like this one. We're starting off with really describing some of the body work and some of those alternative therapies that most people really don't have any clue about that are really impactful. So today, what I want to start with is defining what cranial sacral therapy really is. It is truly amazing. And it was discovered by a doctor and started by a doctor named Upledger. And this book I want to show you, it's called Your Inner Physician and You. And he's the one who writes this book, but it's really about him talking about cranial sacral therapy and somato-emotional release. And cranial sacral therapy was something that he discovered, and I'll go more into that in a really amazing way. But Upledger was an osteopathic surgeon. And so osteo in medical terms means bone, and path or pathology, right, means more disease. But an osteopathic surgeon is someone who actually is specializing in doing surgeries concerning the bones or the nervous system, concerning clearly serious things that are occurring. And so one of...
Maybe you run that back because my phone went off.
Okay.
So starting with he was an osteopathic.
Okay.
Whatever surgeon.
Upledger was an osteopathic surgeon. And so in medical terms, osteo means bone and path or pathology, right, means like disease in medical terminology. So he is a surgeon who specializes in surgery concerning bones or even, let's say, the spinal cord. He can also deal with the brain due to the bones of the skull. But he had been a surgeon for a long time, and he ended up having to perform this surgery, and he found another surgeon to do it with him from France. He started to actually see what we call the meninges. So I can go a little bit deeper. The meninges are these membranes that actually surround what we call the craniosacral system. And this system is really part of the entire nervous system. It's part of the whole body, but it's like a separate system. So you can look at it like there's our skeletal system, there's our muscular system. The craniosacral system is another system, and it's actually a hydraulic type system that houses the cerebral spinal fluid. It houses all of the vertebrae. It houses different nerves in all of the vertebrae and the discs between the vertebrae, along with the meninges, along with the brain and the different sections of our brain. And it does include the cranial bones, and it includes all of those meninges, and there's 3 membranes, and that really houses the entire system. With it, he discovered it, and it was not known previously, because as they had this man, with this opening in his brain and in his body trying to work and perform this emergency surgery, he suddenly became aware of this rhythm that he actually was seeing in the body that was moving and looked similar to what would be like another rhythm that we would have. And I think he was so taken back by it. I remember reading that he looked up at the heart monitor to see if this was actually from the heartbeat, and it was just being felt by what he was looking at, and it was not lining up with it. And then he also went to go check the respiratory rate, and it was not with that rhythm. This rhythm was actually a different rhythm. It was a brand new rhythm that he became aware of. And this rhythm, I want you to imagine here are my temporal bones. This rhythm, this entire system, and the temporal bones are one of the greatest ways to feel the craniosacral rhythm if you're a massage therapist. It actually expands. It expands 3 times, and it actually then draws back in. And part of this is when we have the cerebral spinal fluid and this entire system actually move and become a little bit more vast and stretch itself out. And then the rest of it is when it starts to move back this way. Remember, the cerebral spinal fluid is almost like the blood to the nervous system. If it's said to almost be luminescent, if you've ever seen it, which you typically don't want to, because it would mean that there's a leak or something going on. But at the same time, this actually is like the blood for the nerves, for one of the main systems in our body that is responsible for homeostasis. There's not one section of our body that can have the consciousness on what to do or how to take care of us without this system. And so discovering a system like this is not something small. This was a very profound thing. And in the umbrella of massage therapy, just so that you understand, when you're licensed by the state, it is being licensed with a medical license. Half of our degree is in A&P. So again, that's anatomy and physiology. And that means we study every single system of the body. We're not like someone who studies just a little bit. I've had nurses who became licensed massage therapists later in their career to even tell me that they know that this was way more A&P training than nursing training. And we have to, because no matter what health condition you have going on, as we continue to practice, let's say for medical massage, we need to know all the contraindications due to your health concerns or diagnoses that you have. We have to know all the contraindications for if you have cancer, if you're getting chemo at that time, if you have an autoimmune disease, what kind of medications you're taking. So we have to also understand all the endangerment sites to pressure, where nerves are coming close to the skin and where they're so close to the outer edge of our body that doing deep massage can actually cause nerve damage over time if it's too deep, or cause harm. So it's definitely more complex than most people realize. And as I was saying, in that umbrella of massage, this also includes many therapies, like just to give you an example, like lymphatic drainage. that's one type of thing. We also have Reiki, which is an energy medicine, a type of energy medicine under massage therapy. We have craniosacral therapy. We have myofascial release. We also can specialize in prenatal massage. We can learn different types of like neuromuscular trigger point therapy. I can go on and on. So we almost get to decide when we've passed our test what we want our specialties to be. So with my business, my whole background, just to give you an idea, with my certifications, craniosacral therapy is one of them, Reiki is another. I also do myofascial release, and I teach yoga. I have taught yoga for a very long time and been practicing since my son was like 6 months old, and he is definitely not a kid anymore. So when I'm trying to explain craniosacral therapy for people so that they can understand how impactful it is, it can't be something that's like deep pressure. Some of the most profound and life-changing and healing and like breaking of, let's say, chronic pain, or sometimes even helping diseases almost be able to heal of themselves, can happen through compression to the brain from a part of the brain, maybe that somebody had been in a car accident, and 10 years later, 5 years later, they thought, they got their first scan and everything's fine. And everything's fine at that moment. But let's say one of the bones of the skull actually got a little bit more crushed and is giving a pressure towards the brain, which doesn't always show up on an MRI in the same way that somebody who palpates the bones know exactly where they're supposed to sit, knows exactly when they're overlapping, maybe because of trauma, knows when they might be hurting or compressing a part of the brain, that then after a major trauma, 15 years later, 10 years later, somebody can start having short-term memory loss. Someone can start having dysfunctions if that brain controls the bladder, or let's say it controls your liver. And if that part of your brain is the innervator to the nerves that spread and move throughout, then all of a sudden you can end up having issues with that organ, or it's diminishing in function, and later that can cause disease. So even though this therapy is extremely light and administered more through what we would say is superficial touch, it is really what I like to joke around, it's like no kids play. It is doing deeper work than deep tissue massage. And sometimes as human beings, we are so used to in this world, like, I need to see results, or there need to be a big physical effort from me to know that it's meaningful or doing or something that is impactful. And this is not true. I mean, the breath is something that we breathe in all the time, and it's not harsh, right? It's something that our organs and everything needs. And at times we can actually slow it down through meditation, which can reverse and change the actual mindset of the nervous system from sympathetic to parasympathetic. It can literally calm the mind. It can reduce anxiety and depression. It can start to completely change everything that the body is feeling, along with slowing down the heart rate. So some of the most gentle therapies, it seems like people aren't sure what they are and they don't know to ask questions, but they might be exactly what they need. And that might be more of a breakthrough, and they would have more of a breakthrough through craniosacral therapy than massage, right? Like actual physical kneading or techniques that seem like we're pushing on the muscles. So let me go a little deeper, because I know I'm talking about kind of like complex things and throwing around medical terms at times. So with this therapy, it was like a long time ago that the medical world back in history didn't understand that the cranial bones actually were movable. We knew that when there's a newborn that they're movable, right? As like all their sutures form. And there's even like the soft spot on the top of their head when they're, when a baby's really young, that ends up hardening as the skull gets more protective. And when it fuses, it's still along the suture lines of the skull. And let me see if I can even find a picture while I'm explaining this. But along the sutures of the skull, let's say between the frontal bone and like we have our temporal bones, there's like sutures, right? And this is connective tissue that like it starts to do this and forms this ability to like encase, but this is still movable. So when I'm in trauma, if I have a traumatic brain injury, if I'm in a car accident where it like slam into maybe the steering wheel, this can actually cause compression to my frontal bone. And if it's so harsh, it can actually cause the suture over here for the frontal bone to begin to overlap some of the temporal bone. And this is not good. So in craniosacral therapy, we come along and we actually palpate the person's head while they're laying on the massage table. We actually are able to feel when there's like more compression on one side of the skull. We can actually feel, because it's really a 3D figure, how even in the circle, let's say if I put a bunch of rubber bands through the circle doing multiple directions, if this was pulling this way, then all of a sudden I might have some weird, almost dynamic angle that the skull is getting crushed. I had a man that I helped who was quite an amazing story. And I met him so much later than I probably wished I would have. I would have been able to do more for him. But when I met him, he was 12 years after this traumatic and huge car accident that he was in. And he was hit front on by another car. And he was hit like really at the very front of his head. And it wasn't till about, from what I was told, about 7 years later, all of a sudden it was like randomly he started forgetting things. And, you know, he had gone to the hospital afterwards. He was told he was fine. And as these symptoms started happening, he'd be driving, he'd be doing his work, and all of a sudden he'd forget where he's going, or more things would happen. And it increased to the point that the company, even though he was an amazing worker previously, had to call his wife and say, we can't keep him on. It's like dangerous because he just keeps having this memory loss. And so by the time I met her, I'm pretty sure it was about 12 years after. By this point in time, he had completely lost his short-term memory. I mean, it was like the day that I met him and she's introducing me to him, he was forgetting my name. And it was like almost every minute. If you remember that one movie, I don't remember if it was what the movie was called, but it was like, I think from the 90s, where it was like the person's reintroducing themselves to you over and over again because they can't even hold short-term memory up to maybe 30 seconds or 2 minutes. So they literally forget who you are, but you're sitting there looking at them and you've already introduced yourself. And it's almost unbelievable to be in that situation and see the effects of a traumatic brain injury in that way. And he was told he had Alzheimer's. And this nurse approached his wife and said, he doesn't. He's a victim of traumatic injury, and I worked with Alzheimer's patients. You need to seek other ways to help him. So when she met me, she had tried just about everything, and she had heard about me and had asked me to start treating him. And I remember, it was unbelievable. I remember palpating his head and being able to tell that he was hit on the left frontal side. I still remember it. And that even though he was hit really, really hard on the left frontal side, the load made this huge impact that took the rest of his bones around his skull and almost made the left side of his occiput ridge almost non-existent. It was crazy. While this side was protruding out a little more to relieve pressure. And then at the same time, this temporal bone was almost an inch or more, I would say about an inch past where it should be, compressing and moving out of its ridge. So all of this side was compressed, and this short-term memory side of his brain was so compressed. I honestly said to her, I don't even know how he has remained healthy physically, and that he should actually be having way more serious symptoms. So what does it look like when you start doing craniosacral therapy, but you do it regularly enough and the person is getting the therapy often enough to make the changes? Because you can't just correct 12 years of compression all at once. Every little move that you make to decompress is going to make the brain get this like big breath and then begin to try to fix things. So we never want to overwhelm the body. And it was about, I was combining the cranial sacral with Reiki because Reiki moves chi energy, which is life force energy. So I wanted to help him heal as much as he could or get better. And it was about, I think, 6 months after I started treating him, there was all of these things within that time that started to happen. He started to remember my name. He started to get his short-term memory back. He would be able to have conversations with me. From what I understand, he was always very happy and very positive. But at this time, he became very negative, and part of what his wife loved was his personality came back as we kept doing this. The temporal bone ended up, I was able to get everything to go pretty much back into place over the course of time. And to the point that he hadn't driven in like years because they had to take his license away. And not only did he remember my name and start remembering streets, one night his wife called me and she was freaking out because his memory was coming back and he didn't know he didn't have a license, and it was coming back all of a sudden, and he literally grabbed the keys and he went to go to work where he used to work, and she was upstairs. She thought he was in the basement, which is where he would hang out to read at night. She was watching a show, and next thing she knows, she hears a car pulling in their driveway, and she starts panicking, and she comes running down the street because she realized as she looked out her upstairs window, it's their car. So she comes panicking, running down the stairs, opens up the side door, and there he is getting out of the car. He had put it in park, everything. And he said, I don't understand why, and I won't mention it because of, privacy, why blah, 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 where he used to work isn't open right now. And she realized his memory was coming back. It was unbelievable. So why would I say this therapy is so amazing is one reason for that. Because there's so many things that we can do in preventative care medically if the people are able to know that this therapy is impactful, that this therapy can make a difference in their lives. So that you can understand like the main systems in the body, that what they say in, medical books that make up homeostasis, although all the systems work together, is the endocrine gland system, right? And the central nervous system, the actual nervous system itself. So if you're able to help one of the main systems that actually keep homeostasis in the body, what else is going to be better, right? Kneading is never going to do what giving less stress to the nervous system is going to do. So other things that this therapy can help is chronic back issues. So let's say like vertebral issues, let's say on the SI joint, so the sacroiliac joint, which is the very base of where the spinal cord and the hip bones come together and fuse. And the sacral joint is like an upside down triangle, and it has a bundle of nerves that come out of it like a horse's tail called the cauda equina. And most people don't know this. So most people don't know that all these nerves come out like a horse's tail and that they're actually very close to the surface of the skin. So it's not good to do deep pressure ever on the SI joint, no matter how young you are, because you're going to literally aggravate a nerve. It might have immediate relief, but then a little bit later, you're going to have a back agitation, or you'll feel worse a couple days later, or you'll be exercising and make a move and the nerve is like exhausted from almost being pushed, right, in the wrong way. And in cranial sacral therapy, we actually have a method where the person is up straight, and if they are having nerve impingement, like numbness down their legs or something going on, we can actually go through multiple steps as our hand is on the SI joint, and we're able to decompress the SI joint because it's supposed to be able to move. It's supposed to be able to sway and not impinge any nerves. And when we do this method, it actually decompresses the SI joint, and we can feel it decompressing it. We can feel it release into our hand more. And people will get up off the table when you're finished and half their symptoms or all their symptoms are gone because the nerve's not compressed anymore. So there's one other use for it. Another thing is, we would say somebody like me, I fractured my spine over 10 years ago. So clearly this system would carry trauma. And I fractured literally on my sacrum. It was on the right side. And people kind of call me at times a walking miracle because the statistics for this fracture mean that I should have organ
failure or organs slow down, like my bladder, or have a lot of nerve issues or serious long-term side effects. And between doing Reiki, between all the yoga training I had, between knowing also cranial sacral therapy and doing things and getting the therapies I need and the things that I needed, I have been healed, I would say, to me, 100% in the bone and in most of the things. But what I would say is there's just like a slight teeny bit difference. And that is, I was really strong when I was younger. And I used to be able to like pick up couches and be as strong as dudes. I was always very athletic. And then after this happened, I'm really strong, and I joke around, but more like I'm really strong for really just for being a woman almost. And of course I'm joking, but I mean the physical strength men have are typically more, they're built for more physical strength. And to me, it's like I'm strong, but I definitely can't pick up something that heavy without hurting myself now. The beautiful thing is, over the years with this therapy and doing all these therapies, my bladder doesn't have issues. I would have to go to the bathroom constantly after this happened. And then over the course of time, I can hold my bladder way longer now. I used to have like my glute minimus and medius, which are smaller glute muscles up here. They would just go out on me because the nerves that innervate them was around the area I fractured, and they just would fizzle out, and I could feel it. All of a sudden it would become painful. They wouldn't innervate to actually fire the way they should, which can cause you to walk funny, to be in pain, to make the spine kind of tilt, right? Because all those muscles hold everything in place. So I have my own personal testimony to this therapy that is quite impactful. Some of the other things I would say is, as clients or people get older, they still have this mentality that they want deep tissue, but deep tissue really isn't as great as we age. We actually need the more gentle therapies. We need to keep an eye on the nervous system more because it's aging. We need to watch our stress levels. We need to make sure that those bones aren't compressing those things. We need to try to keep the spinal cord without compression as well. And in cranial sacral therapy, we can also elongate compression to the vertebra and alleviate pinched discs and alleviate different things. But again, it's all very, very gentle. So when you alleviate a nerve in the spine, that nerve might innervate organ consciousness. So that could also help your liver get better. It can help your stomach actually maybe not have the issues it's having. It can help your soft tissue also. It can help all sorts of functions in your body. So I will, and I know that it's like at a distance, you can always expand the screen, but these are just a couple pictures of the complex things of our skull. And you have to remember that even if, let's say, you might have had trauma to your nose, that could end up affecting your sinuses because the bones are kind of moved in the wrong direction or crushed, right, over the course of time. So this kind of shows you the side view as well. And you can see where all these lines are. And can you imagine, like, if any of these lines up here got crushed and overlapped something else, that's clearly going to cause an issue. This is what we call the superior, which means I'm looking down on the skull above, right? Like above my head, looking down on the crown. And this is the back. This is my occiput. My occiput is at the back of my base of my skull. And then here is a suture. So something can happen to make these overlap. And also the one here that I was talking about earlier. And then this view is the actual occiput. And here are your parietal bones. And like this can actually get shoved more under. One of the things that we could say is the trapezius bone, the trapezius, which we call the traps, right? A lot of the times, which everybody seems to know that muscle, is one where we get stressed a lot and it just starts to grip. And as it grips, a lot of people don't realize that the trap is innervated towards the base of the occiput. And so as it grips, all of a sudden we can have this movement where our head gets stuck a little bit more like this. And I'll give you this side view. Like when it gets stuck like this, we have this protruding thing that happens as we come forward. And then as we come forward, the actual chin lifts and then certain cervical vertebrae in our neck get pinched. So with cranial sacral, we can go in and unlatch the occiput and then slowly let it again fall back out into place. And this would also be important because why is this part of your brain called the cerebellum, where the occiput protects, important? It controls your balance, controls your eye health, it controls your ears, it controls even helping people through vertigo. Same thing with, I will say a last couple things on cranial sacral. Same thing, let's say we're talking about TMJ. This helps TMJ, which is very painful for a lot of people. This helps people with chronic headaches. And so I feel like I've given you a good picture. Let's say, I'm sure that over some of the podcasts, we'll talk more on that. So moving forward, just to have given you more of a glimpse of this amazing therapy, there's also another therapy that I want to talk about. And this therapy is called myofascial release. And it seems like the concept of fascia people know, but they don't fully understand. So what really is fascia? Fascia is really this casing around all of the internal structures of our body. But not only is it this casing, it's a connective tissue. So it keeps everything in place. It's between everything you can think of in your body. And so when we have trauma, the fascia has like this consciousness and it holds trauma. And trauma can be anything from a fall, it can be a car accident, it can be even surgery. Surgery, even if it is a positive thing to help someone, is still a violation to the consciousness of the body. The body doesn't like getting cut. The body doesn't like being bothered or opened up, right? So when we do that, the fascia will hold memory of that and it will start to get in this weird disarrayed pattern. And one of the best ways that we explain it is if you think of what used to case all those oranges, right? That netted looking casing for oranges, and you take a string and you pull it, that's like what happens when the fascia might get yanked in one direction and it locks itself, or all the strings start to pull and the entire shape of that bag changes, but it's never going to go back unless you fix it and iron it back out. So fascia can be why people are having a shoulder lifted, a hip lifted or torqued forward or back. Fascia is typically the reason why most people are having pain. The problem isn't always in the muscle. Sometimes the fascia is locked down in such an extreme way that the leg is twisting. And when you do this therapy, it's superficial touch therapy. It's not much manipulation. It actually feels so soft, and the fascia will literally begin to melt like butter and take away its harshness or its restriction and go back in place because it has this inner intelligence, but it needs the prompting. It needs the calmness. It needs the quiet. It needs the nervous system to feel calm. So there's this amazing ability to take pain away and also get the body in harmony and out of misalignment. So one of the things that I try to explain to people is I always seem to educate my clients maybe more than some other people do, to get them to understand the value in the other therapies. Because sometimes deep tissue massage is like really on the scale of everything, nowhere near going to impact them holistically than the other therapies. And I have found that I always explain it this way. Like if I came up to you and I hugged you, but I squeezed you so tight, you might enjoy that for like a couple seconds, right? But it's not going to become enjoyable to have that kind of restriction on you and keep squeezing your body and keep squeezing your body. Eventually, your body's going to start to take that shape and feel like it wants to draw in to protect itself and feel almost agitated, like I'm hanging on you, right? And so I never want to come to the body with therapy in a harsh way. Harshness is never going to bring that balance back to the body. It's never going to make the nervous system go back to parasympathetic. It's instead going to give me a reverse reaction. When I drill into something, it's actually going to make it feel violated and make the body pull in more. So the gentle therapies can be quite profound. And I have most people after them get off my table and they're almost unbelievably shocked. They'll say, I don't know if I've ever not thought so much. I never knew that I could clear my mind this much. That pain is gone, and I can't believe, or I look at me stand in this mirror, and I'm not like, my hip isn't raised, my shoulders are in alignment. I didn't even know that this was possible. There's so many things that people will say that amaze them after these modalities. And one of the other things is they've never been that relaxed. And I think we're living in a day and age where people can take in a tremendous amount of information, but I could tell you all about yoga all I want. And until you step on that mat, until you experience yourself, it is never going to equate to me verbalizing it for you. Same with experiencing these therapies. I can explain all this to you, but the feeling and the peace or what they're going to do for you is going to become a revelation to you when you have them done. And nothing is like our experience. Our experience is our greatest teacher. And so as much as I can educate others, just like when I train them in Reiki, I always say to them, I can explain all that I want, but the biggest way you're going to learn is by administering it to other people so you can feel what it's like when it moves through you, and also getting on the table and experiencing it also for yourself. Those are my two big ways to teach them, both sides of the coin. So, a couple last things that I want to touch base on are, there are books that you can read to understand the consciousness of your mind. Like, positive thinking matters. The body responds to negative environments. The body responds negatively to harsh things. The body responds negatively to abuse, emotional, physical. It doesn't matter what that is. The body will respond negatively to anything that's going to feel like a violation to it. But on the other side of that coin, the body responds when we feel like we're in a good environment, where we're being supported, when we are actually feeling as if we're seen or heard. The body responds. And even now, right, they've proven brain plasticity, which means the mind can rewire itself. So when something has happened that has affected the mind, that's going to affect the body through trauma, it's not only through counseling, that is one big side of the coin of something, but the physical body will never fully heal, and neither will the mind fully, without proper body work to release that trauma, for it to be released out of the actual tissue, because the tissue holds memory. And so there's something to be said about this amazing doctor that wrote this book, and her name is Sandra Barrett. And I could not find, I think my copy was at my office, but this is what the cover to the book looks like, and it's called The Secrets of Your Cells. And you can find it on Amazon. I mean, it's not that expensive, but it will completely rock your world to understanding a doctor took actual cells from our body and studied the power of the mind over the body, and proves how the body responds, but also how environment actually affects it. She even took a bunch of different heart cells that were all beating on a petri dish to different beats, and they somehow, over the course of time, unified their beat. We become a product of our environment, so we need to care about what shows we're watching. We need to care about the music we're listening to. We need to care about the way we speak to each other or to ourselves within our mind or out of our mouth. Do we speak life? Do we speak positive? That is life affirming. If you say to yourself, oh, I'm so dumb, I forgot that, that's never going to help you actually get a better memory, right? The brain listens to you. The body responds to that. It starts to believe it subconsciously. But when you start to say to yourself, I'm going to get through this, when I would say to myself, my back is going to be healed, right? It works. It starts to have an effect. The body begins to actually wire itself back to that healing system. And we have one in our body, and it is amazing, truly amazing. So I feel like that is where I'm going to give all of the deep information, which is quite a lot for you to take in. But what I want to say is this entire podcast is really being inspired out of educating people, being a source of hope and a source of healing for people to find the therapies they need, to find the proper treatments they need, to find their proper, hopefully, practitioners wherever they are by finding their training, by also giving tools. At times I'll teach a yoga practice. At times I'll be administering meditation through the podcast. Over times we'll give lecture and learn all sorts of cool things. But really, the whole inspiration of this is to be pivotal practices. Whatever those pivotal practices are, may they change your life for the better. May you find yourself happy, healed, restored, more balanced, and realize that you are the master of keeping your health, that you have the ability to have more of an impact than you can possibly imagine. And we'll just get into that more as time passes. Have a blessed and wonderful day. Thanks.